Good evening, students. Today I am going to talk to you about a very important topic, and that is spinal tuberculosis. This is also called as tuberculous spondylitis. I'd like to give you a brief outline about tuberculosis. It's a very old disease, and tuberculosis has been found in the mummies of Egyptians. That means the disease is several thousand years old, and the evidence that it occurred in ancient times has also been found by revelations, on the Pacific coast of South America. And ancient times in India also, the tuberculosis was quite well known. Tuberculosis is a slowly progressive disease, and generally, who are affected by tuberculosis, mostly they belong to underdeveloped poor countries of Asia, Africa, and South America, etc. And disease is associated with lower socioeconomic status, number one, people living in poverty, people living in overcrowded homes. And disease recently, in the last few decades, it has been found that it is increasing in the Western world also because of HIV infections. So persons who are suffering from HIV infections are more prone to get tuberculosis. Tuberculosis, there was no treatment for it several decades back, and the only treatment was sanatoria treatment that keep the person isolated in sanatoria where supposedly there was a better oxygen concentration in the atmosphere. Tuberculosis takes a heavy toll of human lives, and it is caused by an organism which is called Mycobacterium tuberculosis. There are so many varieties of mycobacteria, but we are especially concerned with Mycobacterium tuberculosis, which affects the human beings. This organism is a rod-shaped bacillus having an envelope of lipid. This is acid fast, and it cannot be detected in ordinary gram stain. So therefore there are special stains for it, for Ziehl Nelsen stain. It's difficult to culture also, and it is so slow growing that it multiplies itself only in 24 hours. It takes 24 hours to multiply. So therefore what I mean to say is a very slow growing Mycobacterium tuberculosis. You see that basically it can affect any part of the body, and most common part which is affected by Mycobacterium tuberculosis is the lungs. Pulmonary tuberculosis, we call it pulmonary tuberculosis. And to the extent that it may result in extensive pulmonary tuberculosis, disseminated tuberculosis, and generally you see that this organism requires oxygen to grow. So therefore the best part of the lung where it can grow is where there is a better oxygen saturation, that is apex of the lung, the epiphysis of the lung. A person who is suffering from pulmonary tuberculosis, in initial stages it may not be diagnosed, and by the time it is diagnosed, the person has certain type of clinical features which we will discuss. So Mycobacterium tuberculosis affects the lungs, causes pulmonary tuberculosis, and thereafter, through the blood vessels, we call the haematogenous spread, it can involve the musculoskeletal system. And when musculoskeletal system is involved by tuberculosis, 50% of the cases suffering from musculoskeletal tuberculosis, they have spinal tuberculosis. Generally, as far as the involvement of the spine is concerned, it affects the lumbar vertebrae, lower dorsal vertebrae, and cervical vertebra. In children, it is the cervical vertebrae which may be involved, but in adults, it is lower dorsal and lumbar vertebrae which are affected. The disease comes to spine through the haematogenous route. How come? Vertebrae are involved. You will be surprised that vertebral bodies they have got a good blood supply. There are anterior spinal arteries, posterior spinal arteries, there are segmental branches, and these segmental branches give blood to the two adjacent vertebrae. Now, the first part of the vertebra which may be involved is the anterior inferior part. The subchondral involvement is there, and vertebral body has got loops of good blood supply, the veins, so therefore there is a stagnation of the blood, and this is the place where Mycobacterium tuberculosis lodges itself and involves the bone. The first part to be involved is the anterior part of the vertebrae, and when the disease starts multiplying, growing, when mycobacteria starts growing, multiplying itself, it causes destruction of the bone, osteolysis, and there is anterior wedging. There are multiple vertebrae which are involved. When the multiple vertebrae are involved by tuberculosis, by the destruction of the bone, by the osteolysis, there is anterior wedging, and even sometimes non-congruous vertebra may be involved, say D7 then D9 and things like that. So therefore, with such a condition, ultimately this disease, spinal tuberculosis, may result, kyphosis, and there is a gibbous called Gibbus. Kyphosis means the spine becomes bent, and there is a convexity posteriorly. There is an anterior wedging. The anterior part of the vertebrae, they get narrowed as compared to the posterior part, and therefore there is a collapse of the vertebral column, and there is a kyphosis. Patient has got a gibbous. All right, that is the one thing. When the tuberculosis starts, it may involve the intervertebral discs as well, and so the space between the two vertebrae may get narrowed. There is destruction of the bone, there is osteolysis, the space between the two vertebrae gets reduced, and disc itself is involved in the tuberculosis. And after that, the surrounding ligaments and the soft tissue may be involved by tuberculosis, and there is a granulation formation. There may be pus, there may be abscess, and this abscess is called, this disease of the spine is called pot spine, Aries spine. Percival Pot was the gentleman who detected it first in 1779. That's why it is called Pott's disease. And ultimately, what happens is, if the patient is not treated, patient may go into complications. And what is the most dreadful complication of this tuberculosis of the spine? When the vertebrae they collapse, there is a granulation tissue, there is an abscess, so it may compromise the function of the spinal cord. And God forbid, if it is the cervical spine, the cervical spinal cord is involved, person may have tetraplegia. That means both upper limbs and lower limbs are paralyzed. You can imagine. And if the dorsal spine is involved, the person, once this granulation tissue, the necrotic tissue, the destroyed part, the presence of abscess may compromise the dorsal spinal cord, resulting in paraplegia. The person may present with neurological deficit, motor deficit, sensory deficit, weakness of the muscles. So therefore, when there is a pus in the cervical spinal region, it presents itself in prevertebral fascia. It presents itself as a retropharyngeal abscess, behind the pharynx. And if a person has got retropharyngeal abscess because of tuberculosis, it may cause problem. It may go into mediastinum. It may cause difficulty in swelling. It may involve the esophagus. Patient may have difficulty in breathing also. Then patient's life is in danger. And in case it is in the dorsal spine, it tracks down through the psoas muscles, along the planes of psoas muscle. It may come to the groin. This is called psoas abscess. The patient is not toxic, unlike other kind of infections, pyogenic infection. Person is having severe pain. He may have fever, tachycardia. But here, a person who is having psoas abscess, it may present, and ultimately the sinus formation may be there and comes out with the skin also. The lower vertebrae, lumbar vertebrae, sometimes what happens is it may present itself below the inguinal ligament also. So therefore, the person who's having spinal tuberculosis must be diagnosed at the earliest, so that the disease is checked. As you know, there are some constitutional symptoms with the person who's having tuberculosis. I'm deliberately trying to be little slow as far as my talk to you is concerned. Persons who are suffering from tuberculosis, they have fever. A fever is characteristic. A person having fever of a long duration, what we call is evening rise of temperature. The fever comes in the evening. Patient will come and tell you that he gets fever in the evening. These patients, they have loss of appetite. They are weak physically. They have got feeling of weakness, lethargic. They may have night sweats. They sweat in the evening. So there's a fever, loss of appetite, loss of weight, evening rise of temperature, and they have signs and symptoms pertaining to the part which is afflicted with tuberculosis. So there are all kinds of tuberculosis. I am talking to you about spinal tuberculosis. So therefore, I will not divert your attention towards gastrointestinal tuberculosis or genitourinary tuberculosis or some other type of tuberculosis. Now, a person who is having spinal tuberculosis might present with pain, localized pain. There will be bony tenderness. That means once you palpate it or percuss it, the patient evinces with pain. Person might have a gibbous, might be bent forward, kyphosis. The patient may be having some kind of a neurological deficit, a sensory deficit, weakness of the muscles. All right. And there may be, as I already told you, the pus which is getting collected one particular place may come out through the skin, through the sinuses, may come out of the part which is where it is collected and coming out of the skin through the sinuses, making sinus. So tuberculosis, spinal tuberculosis, requires, number one, for its diagnosis, a clear cut and a good history. Here I want to tell you, whenever you talk to a patient, if you are not very much heavily burdened with OPD overload, please pay focused attention to a patient. Spend time in history. Ask him about history. What is he suffering from? What is the duration? What is his problem? What is the environment where he is living? What is his nutritional status? Is he an alcoholic? Is he a smoker? Has he sustained injury? Is there any person in family who has been suffering from any kind of tuberculosis, particularly pulmonary tuberculosis? So these things you must ask the patient. And tuberculosis must be in your mind when a person comes to you who has, I'm talking about spinal tuberculosis, backache. He is having fever, loss of appetite, loss of weight, evening rise of temperature, loss of appetite. So immediately your mind should go, that person might be suffering from tuberculosis, spinal tuberculosis. Once that is the case, after you have taken a clear-cut history, you have done the clinical examination, now you have to diagnose. You see that what comes to your mind first and foremost is general, versatile investigations. Complete blood count and things like that is perfectly all right. But then ESR will be raised in a person who is having tuberculosis, number one. Secondly, you can subject the patient to Mantoux test, that is purified protein derivative tuberculin test. It's called tuberculin test. You give a subdermal injection of purified protein derivative derived from Mycobacteria, and after 48 hours or so you see the effect of the subdermal injection. If there is an induration, now a person who has got BCG vaccination, probably, I think it may not be, it is not exactly misleading, but this may present itself. So therefore, however, if there is a wheal, there is a redness in the part where this tuberculin purified protein derivative has been injected, so person has got, either he is having tuberculosis or he had tuberculosis in the past, or he has been given the vaccination. Okay. So I told you, a person whose ESR is raised, in whom the Mantoux test, this is, you inject this in the forearm skin. If it is positive, it is red. If it is more than 6 millimeter in size, you should suspect tuberculosis. Okay. Then another investigation which comes to our mind is imaging. All right, it is imaging. And what is the best imaging investigation? That is X-ray. A person should be subjected to X-ray of the spine. You may have to do the X-ray of the chest also, to see that a person might be having pulmonary tuberculosis as well, because it's not uncommon for a person who's having pulmonary tuberculosis, who has got a cough, we might be having hemoptysis. Hemoptysis means a person has got blood in the sputum. He has got difficulty in breathing. He may be breathless. So these are the patients who may have spinal tuberculosis also. So once the spine is involved, what you find is that you may have osteolytic lesion. That bone is destroyed anteriorly first. Subchondral erosion. Joint space may be reduced. The space between the two vertebrae is reduced. And in X-ray you may also find hazy shadow, retropharyngeal abscess due to tuberculosis, due to tuberculous spine, cervical spine will have widening of mediastinum in epidiameter. Alright, widening of mediastinum, and you'll find a shadow of the tuberculous abscess, cold abscess also. It is called cold abscess also. And similarly, if it is in the dorsal spine, you will find a soft tissue shadow of the due to abscess. So X-ray will tell you the destruction of the bone, the shadow of the abscess, and you will also find if anterior wedging, the collapse of the vertebra, and person will be having kyphosis. Alright, kyphosis is a forward bending of the spine. So X-ray gives you very good information. So further from X-rays, you can do, good imaging study, which everybody knows. Now it has become a universal investigation. Even the patients are aware about it. That is CT. That is computerized tomography of the spine, which will clearly tell you the depth of the disease. It will tell you what is the extent of the disease. It will tell you about the destruction of bone, the vertebrae. It will also tell you the involvement of intervertebral disc. CT scan will also tell you about abscess, which in X-ray you will find only as a shadow. But CT will definitely tell you about the presence of abscess and the quantity, how much abscess is there. You may have a rough idea about it. CT will also tell you whether the spinal cord is involved, whether the epidural abscess. It will also tell you to what extent the spinal cord is involved. So CT is a very good investigation. One thing I must tell you about, I often say when I talk about CT, it is a very good investigation. But at the same time, it is giving quite a lot of radiation to the patient. In past, I remember what we used to read in the books is that in earlier CT machines, the dose of radiation which a person gets used to be equivalent to 1000 X-rays. Now the things are better. So therefore, CT has got this hazard that it gives the patient excessive radiation. However, we have another better investigation for spinal tuberculosis, that is MRI, magnetic resonance imaging. It is a very good investigation for soft tissues. It will again tell you what CT has revealed, but it will also tell you the soft tissue involvement. It will also tell you the path of the tuberculous abscess. So MRI is a fantastic investigation, I must say that. Now we have other tests for spinal tuberculosis. There, first of all, is that you can find the Mycobacterium tuberculosis bacilli in abscess. So therefore, when you want to get the material from the spine, you have to do needle aspiration, which is both diagnostic and therapeutic also. And of course, you do the Ziehl Nelsen staining, and you'll find the bacilli in significant number of cases. Ziehl Nelsen staining. Ordinary microscopy will not reveal the tuberculous bacilli. It is a Ziehl Nelsen staining, a special stain. This is acid-fast bacillus. So therefore, you can find it out by staining in a material which you have aspirated. Then comes your, sometimes the bone destruction so much you might have to do a biopsy. You may do, fine needle aspiration cytology, popularly called as FNAC. FNAC. You hit the place, you hit the site which is affected by tuberculosis, and therefore you may require CT guided FNAC. What did I say? That under CT guidance, patient is subjected to CT, computerized tomography, and where you find the lesion, you put a needle and you take out the tissue, whatever. The cells, FNAC can only give you a cellular diagnosis, right? And if it is not successful, then you can subject the patient to, you may have to resort to any kind of biopsy, including open surgery you may have to do. You may have to take out the tissue, the affected bone or the soft tissue, by resorting to open biopsy. And what are the characteristics of histopathological changes in tuberculosis? You find there is a caseation, there is a necrosis, there is the tissue is destroyed and necrosed. You cannot find its identity, and this is surrounded by cells. You must be aware by now, lymphocytes. We have lymphocytes in our blood, so there will be accumulation of lymphocytes, and you will find epithelioid cells. Remember the word, epithelioid cells are there. There is a necrotic tissue in site, caseation, surrounded by lymphocytes. There are epithelioid cells, and there are multinucleated giant cells. So that histopathology is foolproof. It gives you the conclusive diagnosis, that is the ultimate, and that is the final. It gives you the final diagnosis. Then we have got other tests like, PCR test and things like that, so many. There's a gold test also, but they are not very specific. So we focus upon history, clinical examination, imaging studies, culture. The mycobacteria might be cultured. It takes very long time for Mycobacteria tuberculosis to be proven by culture, Jensen media. So therefore, by the time, if you keep on waiting for weeks together for the culture, we are entitled, let me tell you one thing very clearly, that if a doctor or a physician or a surgeon has his doubts that person is having tuberculosis and he is not being able to prove it conclusively by any method, patient should not be denied the benefit of being exhibited anti-tuberculosis treatment. All right. So there are few things are mandatory. Whatever and wherever the tuberculosis, you have to take X-ray of the chest, which is very important, and those investigations which are specific to the part involved by Mycobacterium tuberculosis. All right. So therefore, we wait till the investigations prove that patient has got tuberculosis. If not, patient should not be denied the benefit of getting tuberculosis. You give ATT for 14 days. If the patient benefits, he improves, his fever goes down, his pain comes down, and he is improving, his appetite improves, please continue with the ATT. All right. So what can we do to the tuberculosis patients these days? I salute those people who have made the lives of millions and millions and millions of people very comfortable in all aspects of life. I'm not talking about they have found out Mycobacterium tuberculosis or they have found out the medicines which are proven by trials, multicentric trials, double-blind studies, and it's not a theoretical guesswork. It is proved. So I say salute to those people who have given us so much, not only the medical field, but as far as technology is concerned. The technology has made the diagnosis of diseases very fast. About 4 5 decades back, we have nothing with us except X-ray. There was no ultrasound, there were no MRI, there were no CT or things like that. Even there were no medicines also. So there is a boom, there is a revolution, and there's just 1 or 2%, a few people make the lives of millions of people so good. So what do you call them? Angels. You have to accept that, acknowledge it. You must acknowledge with grateful thanks these people. The patient himself does not know the ATT, who has made worked on ATT, who has divides CT or MRI. So anyway, whenever a person is affected from tuberculosis, he should be given ATT. And mind you, you must exclude that a person is not having HIV, because there is a good relationship between HIV infection and the tuberculosis. There are so many studies which have been done and it has been found that those people who are having HIV, somewhere around 13% or so, there are different statistics, they have tuberculosis also. Those who are having tuberculosis, their nutritional status should be improved. They should be given a good food, a better place to stay. They should be, in earlier times they used to be isolated and secluded. No more. We need not isolate a person who's having spinal tuberculosis or things like that. Earlier, when pulmonary tuberculosis persons, they used to be isolated in isolation wards and things like that. So let me tell you quickly that we have got an intensive therapy and a continuation therapy for tuberculosis. And WHO guidelines one must follow. We give 4 drug combination for 2 months. A person who is having spinal tuberculosis is given 4 drugs for 2 months, and thereafter for next 4 months he is given 2 drugs, right? 6 months course. But a person depends upon the extent and severity of the disease. However, for spinal tuberculosis, 6 months initial intensive ATT for 2 months and continuation therapy for 4 months may not be sufficient. So therefore, these patients may require ATT up to 9 months. And still, some of them may require this therapy, ATT, for 12 months even, right? So what are the drugs we give here? You should remember, number one, earlier we used to have, different kind of therapy, and one of the part of the ATT was streptomycin. But streptomycin had one problem with it, that it could not penetrate the tissues as much as the other anti-tubercular drugs can. So simply, at your level, we can say that you should remember the drugs which are given. They are number one, Isoniazid. Isonex used to be called Isoniazid, right? Roughly you can say this is given in the dose of 5 mg per kg body weight, 5 mg per kg body weight, somewhere around that. Isoniazid is given 5 mg per kg. of the body weight. Next is the rifampicin. Rifampicin is given roughly around 10 milligram per kg body weight. Rifampicin, unfortunately, sometimes it may cause very severe life-threatening reactions also. And it may cause hepatic toxicity. So anyway, this is very, very rare, but however, I am saying is that Isonex, Isoniazid, Rifampicin. Then comes your Ethambutol. Ethambutol, roughly around 15 milligram per kg body weight. And then comes your Pyrazinamide. Alright, 20 milligram per kg body weight, and along with you give, because some of these are neurotoxic or may cause neuritis kind of a problem, so therefore we might have to give, it should be combined with multivitamins B1, B6, B12, etc. Okay. Now, just because of extensive use, so remember the 4 drugs: Isonex, Isoniazid, Rifampicin, Ethambutol, Pyrazinamide. So all these drugs are given for first 2 months, and thereafter you may give Isonex, Isoniazid and Rifampicin for next 4 months, or if it is extended for up to 9 months or even up to 12 months. Okay, but cases are there where it's not so uncommon, where the patient develops resistance, what is called MDR, multi-drug resistance. Multi-drug resistance, dreadful problem. Or it may, person may develop extreme drug resistant XDR tuberculosis, MDR TB, XDR TB. So then, there are second line of drugs which may have to be given. Alright, there are a variety of second line of drugs in the market, but the best choice of treatment of tuberculosis are what I said: Isoniazid, Rifampicin, Ethambutol, and Pyrazinamide. Okay. Now, if a person is not benefited by ATT, or their complications have set in, like there is abscess inside, there is a paraspinal abscess, or there is debris inside due to destruction of the bone and the soft tissues, there is a pus inside, surgery may have to be done. This pus has to be evacuated. You can do needle aspiration also if there is a pus. However, if there is a necrotic material inside, it has to be removed. Person may have, cord compression, that has to be relieved. Otherwise, person will go in for paraplegia. The vessels, anterior and posterior spinal artery, they get thrombosed. So there will be a neurological deficit. So that has to be corrected. Or to improve the structural deformity of the spine, the person might have to be treated by instrumentation. So to correct the spinal deformity. Alright. And then finally is the rehabilitation, in the sense that person may require frequent reviews. In earlier times, what used to happen is the person having spinal tuberculosis, he used to be, we didn't have the state-of-the-art kind of a, spinal jackets or spinal braces or corsets, and person used to lie on, and we used to apply POP jacket, plaster of Paris. This we have done, I have done it. That person used to be given jacket, and life becomes miserable. The person sometimes may feel himself that he is not able to breathe. The entire chest and abdomen, is encircled by POP, plaster of Paris. We used to make POP ourselves. These bandages used to there, and we used to put on this thing, calcium carbonate type of a thing, and then wet it in water, and then we used the person is given a jacket of cotton first of all, and thereafter we used to apply. But now you have got so many devices, so that can also be utilized. Okay. and person must be properly counseled toward future. What can we tell him? Take good nutrition. What is the good nutrition? You must know. Anybody's diet should have 40% carbohydrates, 40% of fats, and 20% of proteins. And there is no point eating in a food which has got a nonsensical value, which adds to your weight, the fat. And central abdominal obesity is a dreadful thing. It goes straight into the liver, metabolized. You get a fatty acids, and fatty acids these are utilized by the muscles, leaving glucose behind. Steals the job of the glucose. The person gets hypoglycemia. So what I'm talking about is obesity is a dangerous thing. The person should not eat the food which is meaningless. Of course, you have to have, as I've already told you, one has to take carbohydrates, fats, proteins, elements, vitamins, everything. So therefore, person must have apple, person have banana, person must have, whatever. There are so many items which has protein, but I can tell you that 45% of protein is found in this thing. What you call the sprouts. All right. It contains 45%. I think it's more than your meat preparation. Soya beans are there, chana is there, bengal gram is there, mushrooms are there, buttermilk is there. It contains, there's a very good proteins it has. All right. And those people who are nutritionally balanced, they live longer. Person must do breathing exercises, what we call pranayama. Must take a deep breath inside and out. Give, respect to your body. These hands and feet and heart and lungs are subordinate to something unknown inside. God only knows what is that. Of course, it is all hydrogen and helium. We are derived from that. So therefore, pay attention to your physique and body. Don't get it disfigured. You had been a very handsome person in your younger age. Maintain. You cannot reverse the age, but at least your weight can be at standstill. How odd it is. A person keeps on lamenting that, look, when I was young, I was 25 years or 30 or even 40, 45 or something like that. I was so handsome and I was so comfortable. But now look at my shape. I have got a punk which is coming out. I have become disfigured. Getting figure or disfigure or remaining youthful is, is a $1 million problem. A person cannot say in his old age that he is as attractive as he used to be or she used to be, but at least try to maintain, keep this house in a good shape. So therefore, how can you do it? Nutrition, I've already told you that please do breathing exercises. Walk. At least young person can walk, can run. If you are not running today as students, you are not walking and you are glued to, you understand what I mean to say? All right. These fingers are working very fast. Sleeping at midnight at 12 o'clock, 1 o'clock, getting up at 9:30, 10 o'clock, 11 o'clock or something like that, or getting up early, you are spoiling your health. Let me tell you, it is written in the books. It is written in our books that a person should not take the food beyond 8. Your food, ideally, particularly those who are diabetics, who are suffering from diseases, your food should be over latest by 7:30. You have to take so many medicines, but if you were having late hours, you are taking medicines, who is going to see the effect of the medicine what you have taken? And then while in sleep, you don't know what is happening to you. It happens. So therefore, finish your food and medicines, everything in time, so that you have sufficient time yourself to watch for the effects of medicines. So I have told you good nourishment, breathing exercises, walking, running, and whatever you do it, and sleep early. Nobody should be found awake after 10 o'clock. If you sleep at 1 o'clock, when are you going to get up? I keep on watching the birds. The birds in this world, I think you should remember Mycobacterium avium also. The birds and animals, they have come in this world much before we people have come. They are acclimatized to earth. We are not. We neither can tolerate heat, nor are we, you know, immune from cold. We got a very thin skin. Animals got a very thick skin. They are hairy. We are not. They don't require